the problem is your lifestyle. It's the problem is the food that the patient eats. The problem is the sedentary lifestyle of the patient. So if you just put the patient on medication, then you will only control for the symptoms, but you won't be able to solve the root cause of the disease, why the patient has the disease in the first place.
Hi everyone, welcome to a very special episode of Simply Healed, because today we are observing World Diabetes Day, and a special thank you to the International Diabetes Federation for highlighting our special episode. And of course, welcome Dr. Jansen.
Hello Shan, hello everyone, happy to be here.
Dr. Jansen, diabetes is actually your bread and butter, right?
Yes.
As a lifestyle medicine doctor, you specialize in metabolic syndromes. I mean, that's the most easy thing and direct thing to treat with lifestyle medicine. And today, on World Diabetes Day, can you tell us a simple question? Number one, can diabetes be reversed?
Yes, absolutely yes.
Okay, doc, but there are some doctors and even specialists, diabeticians, right, who say that diabetes cannot be reversed. Can you clear that up a little?
Well, it's because diabetes is a lifestyle disease. Now, if it's a lifestyle disease, then the solution to that problem is also lifestyle change. Okay? So there's no way for you to reverse diabetes just by putting a patient on medication alone.
Because you're always creating the problem every day.
Yes. The problem is your lifestyle. The problem is the food that the patient eats. The problem is the sedentary lifestyle of the patient. So if you just put the patient on medication, then you will only control for the symptoms, but you won't be able to solve the root cause of the disease, why the patient has the disease in the first place.
Doc, I think while we are saying this, and to all the diabetic patients that are watching us right now, I think it will be very helpful to thoroughly or more clearly understand what it means to be diabetic. You know, Doc, for most diabetics, being diabetes means I have a high blood sugar level. Is that really what it means to be diabetic?
Now, high blood sugar level is just a symptom of diabetes. Now, that is what doctors measure to know how severe your diabetes is. But if we define diabetes or what we're discussing right now is mainly type 2 diabetes. It's insulin resistance. So insulin resistance means is that your insulin is not functioning well anymore, or your body is not responding to your insulin that well anymore. So remember, the main function of insulin is to decrease the blood sugar. Okay? So, it's so that your body can utilize the stored sugar in your blood. So insulin resistance just means that your insulin is not working well anymore. Yeah.
So as a diabetic patient, it is not that you have high blood sugar, because what we need to focus on is not your high blood sugar, it's your body's ability to be sensitive to insulin.
Correct.
So medication only lowers your blood sugar.
Yes.
But what you really want to do is address this. So I'll give you a clear example. I can go for a dessert buffet. Nothing but chocolates and cakes and candies. And 2 hours later, I will be technically diabetic by a normal person's understanding, because my blood sugar level is very high. But I'm not diabetic because all I need to do is go home and rest, and my body is able to get rid of that sugar naturally, and I'll be fine the next morning. So to all the diabetics out there, it is not about your blood sugar level that makes you diabetic. It is your inability to use your insulin properly. So today, Doc, you'll be talking with us about reversing diabetes. So reversing diabetes is not lowering your blood sugar. Reversing diabetes is correcting your body's ability to use insulin, making you insulin sensitive again. That is what we mean by reversing diabetes. Now,
yes.
Doc, how do we do that? First with lifestyle, and perhaps later for those of us who are less disciplined, what other options do we have?
Okay, so first we have to define what diabetes, the different levels of diabetes. So this is the normal blood sugar level. Okay, this is fasting. So normal is between 60 to 100. Pre-diabetes is between 100 to 125. Then diabetics are those who have a blood sugar level of more than 125. Okay? So that's what it is. Now, you have, please remember the values.
So what is your level? What is your level right now? All right. So are you normal, pre-diabetic, diabetic, or is it really serious? Are you a 10 or 12?
Okay, so I'm going to teach you one technique on how you can reverse diabetes through diet alone. Now, please remember, the study that I'm going to present to you is in a very controlled environment. So this is actually not in a realistic situation. Now, I'm going to teach you later on after this what techniques or what strategies should you employ in the real world. Okay, if you're out there deciding things on your own, okay, making choices on your own. Now, see here. Now, if we talk about reversing diabetes or controlling for diabetes, immediately the first thing that comes to the mind of a patient is to lower your intake or lower your intake
Eat
of
less sugar.
eat less sugar,
Eat
eat
less
less
carbohydrates.
carbohydrates. Okay, so focus more on protein and fats.
Like the keto diet.
Yes.
Many patients or diabetic will swear after they go on a keto diet, their blood sugar levels are down. So
Yes.
again, if you define diabetes as your blood sugar level, then you are better now. But that's not true, right?
Yes, that's not true because you only address the symptom. Okay,
So if a keto diet person starts even eating one bowl of rice,
the blood sugar of that person was spiked very high.
because though they had low blood sugar while they were on keto, nothing was being done for their ability to use insulin, to be sensitive to insulin.
Correct. So now, the researchers of this study actually did a very different approach. Instead of a very high fat, very high protein diet, very low carbohydrate diet, they did the opposite.
Oh, a high
Okay.
carbo diet.
They did a very high carbohydrate
That's like
diet.
everything no for
Yes,
diabetic.
a low fat diet, and
Uh-huh.
protein they controlled.
Okay.
They controlled for the protein, like, right? So okay, they had two groups. So the experimental group had a macrobiotic diet. So a macrobiotic diet is this diet. So they fed the participants this meal. Okay.
Oh, that's some interesting items down there.
Now, if you can notice, no, if you can notice the meal that we have just shown you, it's mainly a whole food plant-based diet. So this kind of diet is plant-based. It's very high in fiber, okay, but they are all carbohydrates, okay, and very low in fats, actually, no. So this is the experimental group, and the control group. They had the control group eat at least 30% fat. Okay.
Wow,
And
that's
then
quite a
around
high fat
4
intake.
yep, and around 49% carbohydrate intake. Okay, so if you compare that the control diet to the experimental diet actually has 73% that comes from carbohydrates.
Take a look at the comparison on the screen right now. On one side is the control diet, on the other side is the experimental diet. You can see the difference between the protein levels, the fat levels, and the carbohydrate levels.
Okay, so after 21 days, after 3 weeks, okay,
That's
so
not very long, not even a month.
yes, it's not even a month. So take a look at this graph. Okay, so on your x-axis is the number of days that the participants have been on the diet, and on your y-axis is the fasting blood sugar level. Okay, now take a look at the red dotted line. So it's at 100, right?
Yeah, anything below that is normal.
Yes, anything below 100 again is
Normal.
Yes, you're right. Anything above 100 is either pre-diabetes or diabetes. However, it's just the semantics, okay? Whether or not you're pre-diabetes or you're diabetic, you are already insulin resistant. Okay? So, again, take a look at the graph. Take a
Wow,
look at
I'm shocked. I mean, this is not just 120, it's 130 blood fasting sugar level. And in 7 days. In 7 days, normalization.
yes, in just 1 week, those who are on the macrobiotic diet or the whole food plant-based diet have normalized their blood sugar level down to 100. Okay? From around 130, okay, when they started.
Doc, when they normalize over here, is it because they're low sugar? No, that's not true, because their diet is so high in carbohydrates. So it's like you're eating all the wrong stuff based on normal understanding. yet your blood sugar is going down. So what's happening here? Is their insulin resistance being changed?
Yes.
And it's so fast without medication?
Yes, exactly.
7 days?
Exactly, because the insulin resistance is already being reversed here. Because insulin resistance, okay, happens to increase or worsens when you have a very high fat intake, if you have fat toxicity specifically.
I hope everybody is getting this, right? The blood sugar level, which is the symptom, is normalizing not because you have stopped taking carbohydrates. In fact, this diet is 73% carbohydrates, but yet the blood sugar comes down. So we are really addressing the actual disease of diabetes itself, improving your insulin sensitivity. And it's all got to do with fats.
Yes, correct. Okay. So here's another table, no. So it's by following a whole food plant-based diet, it's not just the blood sugar that improves. It's also your cholesterol level. Okay, because remember, the whole food plant-based diet or of the experimental group had only 15% fats. Okay, and if you increase your fat intake, your body's cholesterol level will also increase because the body will need to metabolize the fat that you just ate. So as you can see here, take a look at this table. No? As you can see here, the group who are on the experimental diet or the MAPI-2 diet or the whole food plant-based diet, no, from 102 LDL cholesterol, it went down to 62
Wow.
in 3 weeks.
That's amazing.
Okay,
That's
so
really amazing.
that is 47.9% decrease.
Wow.
And compared to the experimental diet, wherein they had around 30% fat and 49% carbohydrates, it went down from 100 to 81. So that's around 20% decrease. But it's still significant. However, as you can see, if you follow a very low-fat diet, the more pronounced is the decline in your bad cholesterol, the LDL cholesterol. Okay? So why am I emphasizing LDL cholesterol? It's because LDL cholesterol is the main culprit or is the major risk factor for developing heart disease or blockages of the arteries of your heart. Okay? So how did this come about? Now, what exactly is the root cause of diabetes? How can we explain this phenomenon? Let me show you how insulin resistance comes about. For example, we have a muscle cell. So inside the muscle cell is this membrane. So we have the blood sugar staying outside the cell. Now, how does the blood sugar normally goes inside the cell? So we have insulin. Now, insulin attaches to this receptor, which results into a cascade of cell signaling process. Now, at the end of the cell signaling, we have this vesicle which goes into the cell surface and opens up the cell membrane so that blood sugar can now enter inside the cell to be used for metabolism, to be used as a fuel. Now, what happens in type 2 diabetes or insulin resistance? Now, you have your insulin which attaches now to this receptor. However, nothing happens. Now, why is it so that nothing happens? It's because of something what we call as intramyocellular fats. Now, the intramyocellular fats block the cell signaling cascade or the cell signaling process such that nothing happens. So, the cell membrane cannot open itself up to allow the blood sugar molecules to enter inside the cell to be used as fuel. So, the blood sugar rises.
All right, Doc, thank you for that wonderful explanation. I do want to ask some real life experiences. And you have patients that are like that. You tell them to eat correctly, but they don't. What do you do? What supplementation can they take? And how would it work?
Yeah, so number one, I put them on Simply Nature PPARs. Now, PPARs is actually a gene activator. So, the main function of PPARs, okay, is to stimulate fatty acid metabolism. Now, the main problem of diabetes is fat toxicity.
Oh, wow.
Now, PPARs will help your body metabolize more fats. So, you reduce the amount of fat toxicity
So you
in your
unclog.
body. You unclog your arteries. You open up
your ability to be
yes.
sensitive to insulin again.
Yes, you open up your ability to be sensitive to insulin again. In the video that I showed you, you open up your cells so that your cells can receive the blood sugar. Okay, so it's also an insulin sensitizer. And what's wonderful with this is that it's a natural product. It's not a drug.
It's a food. It's
Yes,
literally
it's a food. It's
another
literally a
food, but it's a very specialized food that just happens to have these combination of
Exactly.
PPAR agonists.
Also, not only that, no, since it's a whole food, it not only acts on the insulin itself, but also it has a lot of antioxidants, a lot of phytonutrients that can help minimize inflammation inside your body as well.
And that is also another problem of diabetic patients.
Yes,
because
exactly.
they have other diseases because of the high
Yes, correct.
inflammation.
Okay? Yeah.
And with that, Doc, I can see there are many questions coming up, and one thing special to all our new viewers, one thing special about our health talks is we have a very significant Ask Me Anything segment, and that is where audiences like yourselves ask questions, and more often than not, please stay on because you'll find answers that are relevant to your issues in other people's questions. So without further ado, let's move on to the Ask Me Anything segment.